New Year's resolutions always sound good, but they aren't always the easiest things to keep up with. And for most people, it's all about getting ourselves healthy and in shape. And with ways to keep up with that resolution, we're joined by Dr. Mike Sevilla from Family Practice Center of Salem. So good morning, glad to have you here.
Good morning.
Yeah, so we talked last hour about New Year's resolutions, how they can be difficult to stay with it, but you did have some tips that you've been giving to your patients when they ask you about their New Year's resolution.
Yeah, just in general, when I've been talking with people, especially if they want to start out, with a diet and exercise program, a good thing is really to check with their doctor, especially if they do have family history of things like heart problems and diabetes, before you start out on that diet and exercise program.
And it doesn't have to be a huge drawn-out plan. You had said that it can just be something simple like drinking more water.
Exactly, yeah. I mean, when you do some simple things, like drink 2 8-ounces of water a day, unless you're going to be exercising more, then you do more than that. And people can always get more sleep. I know it's always tough to get sleep, but trying to get that 8 hours of sleep can really recharge you and start your day off well. And
I think maybe even something simple too, like subbing one of your not so good snacks for just something healthy, just one a day. I think that will make a difference too.
I think doing some meal planning, and people, especially at work, when they get tired, and frustrated, they reach for that sweet.
Oh, yeah.
But if you can put even a piece of fruit or a piece of some kind of vegetable there, that could really start off your exercise diet and exercise plan well.
I think something else that's kind of difficult too, I know I'm guilty of it, is when you are on that plan, it's kind of hard to stick with it because by the time you reach February, not everyone is going to the gym like they planned. They're not eating as well as they planned. They did well in January, but after a few weeks, kind of falls off track.
Yeah, what I tell people is that if you have people that you work with, or you have a family that you can share what your plan is, people that inspire you, and they can also kind of keep you accountable as far as your diet and exercise plan. That's always a great plan to kind of start your year off right.
And what about incentives? Do you think that also helps?
Well, I mean, people always want to, especially if they have habits like stopping smoking, that there are tips that you can do that. And I always tell people, how much money can you save by stopping smoking?
Sure.
And sometimes that's very motivating to people.
I think that works too, fast food or maybe getting Starbucks every day, things like that. Just kind of, saving that money too. You can do something nice, treat yourself that way.
A little bit adds up, and people really feel it. And if they stick with it, especially through January and February, I really think they're going to be successful.
I think that's a big part too, is just starting simple and you don't know where to go.
Exactly.
All right, thank you so much. Always good to have you here.
Great, thanks so much.
All right. Well, New Year's resolutions always sound good, but they aren't always the easiest things to keep up with. And for most people, it's all about getting ourselves healthy and in shape. And with ways to keep up with the resolution, we're joined by Dr. Mike Sevilla from Family Practice Center of Salem. So good morning, glad to have you here.
Yeah, great to be here.
Yeah, so when it comes to New Year's resolutions, for a lot of people, it's all about getting yourself healthy and in shape. So what have you been hearing a lot from some of your patients?
Well, especially this time of year, I hear a lot of my patients that they want to really make some changes in their health when it comes to the new year. Everybody wants to lose weight, exercise more, and to eat better. And I have a lot of those conversations this time of year with my patients.
I think it's for all ages of people too. I mean, everyone wants to stay healthy. So is that what you've been hearing a lot too?
Absolutely. And when I talk to my patients, there's some tips that I give them. I tell them, especially try to, tell some of your friends, tell some of your family, some people that inspire you, some people that are going to keep you accountable. And that's a great first tip that I give my patients.
I think one of the biggest things that we see, I'm guilty of it myself, you make this resolution and by February, you're not going to the gym anymore. You're not, you kind of give up. So how do you stick with it?
Well, what I tell people is, just to take it a little bit at a time. A lot of people say, well, I'm going to exercise, 7 days a week and do all this stuff. But take a little bit at a time, maybe once or twice a week. Start very slow, especially if you don't exercise a lot. Maybe start out 15, 30 minutes, and then I kind of build up from there.
I think it's important to know that you're not going to notice a change immediately, so give it some time too.
Exactly. So I mean, if you're going to, exercise a little bit more or eat a little bit better, maybe plan a little bit better, plan your week as far as what you're going to eat, and maybe try a little bit smaller portions instead of denying yourself all those good things that you like to eat.
I mean, because it is the holidays after all, so we're going to be surrounded by a lot of those good things to eat.
Exactly. And my patients say, what kind of typical diets do I have to eat? Do I this diet, that diet? And I tell my patients, everybody can eat a little bit more fruits and vegetables with each meal.
Sure.
Don't go for some of these fad diets. Start a little bit at a time.
All right, Dr. Sevilla, thank you so much. And you're going to join us in the next hour or two. We'll talk a little bit more about getting that perfect New Year's resolution.
Sounds great.
All right, thank you.